Well, good afternoon, Facebook family. We're back again, and I welcome everyone. As you know, we're in a series that we are talking about fatherhood experiences and grandfather experiences, as we will today. We're talking about healthy habits. We're talking about how fathers contribute to fostering generational health in their fatherhood and in today's grandfather journey. I have the privilege of having someone that is from our community, has done so much wonderful work in our community. I consider him a dear friend as well in this work in public health. We have Dr. Sergio Ramola here with us today, who um, Dr. Ramola, thank you for being here. You have been an inspiration to me since I've been here with the health department. But could you tell us a little bit about yourself before we get started?
Well, first of all, I want to thank you, Mingo, for the invitation. I want to thank the Fairfax County Health Department. I think this is a very important conversation. Just going to give you a little bit of my background. I was born in Guatemala. I migrated in 1985 due to the uncivil unrest that we have there. And when I arrived to the United States, I came with my wife and two daughters. At that time, they were 6 and 7. And we have a big change in our lives because they were living in a house in Guatemala. They were attending private school. And all of a sudden, we land in New York, who is a big city. We live in a small apartment, and we have to learn the language, which was very difficult. And then we have to work very hard to pass the exams, the requirements to be able to go into a residency program in the United States. So it was not easy to navigate having two young children, and for them also was a very was a big change coming to the United States, but with the support. And I have to give a lot of credit to my wife. Of we just celebrate our 45 anniversary,
Oh, congratulations.
and for the support that through all this year, you have to have support in order to achieve what finally we have now. We are I have 3 daughters, and I have 8 grandchildren all over the place. One family lives in Sweden, my other family lives in France, and one family lives here in Virginia. So I feel very proud of my daughters and my grandkids as well.
Well, thank you. That's awesome. I tell you, it's just so wonderful to hear through your eyes the accomplishments of your children, and they're off in their places in the world. But we know that both moms and dads obviously play a vital role in establishing our children in a place where they can thrive on their own with their own families in the future. Part of what we're talking about in this series in particular is the father's role of fostering healthy habits, whether we call it the four pillars of health around our physical health, our emotional health, our mental health, and our spiritual health. I know that you are a physician. Obviously, even though you have a practice of being a physician, could you share how you brought some of those aspects back home to make sure that your family and your children thrived in that healthy way in those four pillars that I mentioned before?
Well, first of all, just talking about what is spiritual health, what it means to me is, and I always have been that way, is in a way to have a good moral character and decent beliefs. And it also represent, it's like a balance between what is physical, psychological, and social, and different aspects of human life. Um, to me, has been something that, in part, is helping other people without expecting that I will have any rewards. So something that as a physician, and I'm trying to transmit to my family to be a good role model in this aspect is to teach them that you have to have a balance in your life and the spiritual point of view. It could be a connection with God, it could be a helping your community is very important. And I will say that for them, this is going to be my kind of my legacy if they can, do some of the things that I am been doing with the community.
Yes, yes. And then obviously you're a physician, and were there, could you kind of let us peek into some of the things that you would do with your own family to make sure they're eating healthily, all those sorts of things that I know that would come quite natural to you being a physician.
Yeah, it's first of all, as a physician, in the aspect of particular some of the specialities, my is obstetrics and gynecology. It is quite stressful at times because you have to be out of the house many times because you are on call or you have to go to the hospital to deliver a baby. So a lot of times when my kids were growing up, I was not present during, or maybe I was in a birthday and then I had to leave, and so it was kind of difficult. So I found a balance in the time that I have together. We try to enjoy, like for example, doing a lot of outdoor activities is very healthy. Exercise, is something that all my kids, I was present. They did the sports. When they were in soccer, ice skating, swimming. We were always there with them. And I try to be present in all those activities. And the other thing is that I tell my kids, actually I'm very proud of my daughter because I will say that they are very excellent parents, and they like to eat very healthy, and they are mostly organic products, and they have and I believe that this is something that I pass to them, and they are doing the same with my grandkids. When I have my grandchildren, one of the things is that of course once in a while they can have a little not so healthy, because it's good that they try a little bit, but for the most part, uh, I encourage them to eat healthy because in the long way, if they eat healthy now, they are young, there's going to be less risk of obesity, and something that the Latino community suffer a lot is, for example, diabetes.
Yeah.
And if you have the kids eating a lot of junk food, and they're going to be more likely to become obese. So that's something that we are always recommending, eat healthy, exercise. We try to do as many outdoors activities and family. I think this is part of the being healthy and have a good balance, between the physical and emotional.
No, I appreciate that, and I know, in we as fathers, and even obviously with moms, we're talking fathers today, but our children, have reached, they'll reach stress points. Maybe it's an exam in middle school or high school, or getting ready to, pack to go to the first day of school, or maybe even it's the first day of camp. All those things on this, could be stressful for a child. Could you share just some wisdom around what other fathers may be experiencing some of that, because we're just starting school, how they might be able to navigate some of those things with their own children?
Yeah, that's one of the things that for me coming from Guatemala, because the schedule is completely different for kids in school. They go to school and they usually come back home to have a lunch, no, and then they go back to school in the afternoon, or the parents prepare lunch. What I was not very happy when my kids were going to school is that I found out that the lunch that was given at the school was in general not very healthy. They have a
Right.
lot of I think this has improved over the time, but I will recommend the parents nowadays. I think a lot of the programs that they were given with the COVID-19, they were given free meals for kids at the school, but I think that kind of stopped now. I think it's a good opportunity for the parents to make sure that when the kids they have their lunch, to have a portion of vegetables, fruit, and something healthy, to bring to the school for lunch, and not to bring food that is not healthy.
Yeah. Back to when we talked a little bit about stress, is there any kind of stress management advice that you could give to our fathers? Particularly, let me give you an example. Like, um, we may work and obviously experience stress at work. How bringing that home could basically translating that stress to your child. Is there any advice that you can give to fathers around how not to bring it through the front door with them?
Yeah, no, it's extremely important that we all have careers that at times can be very stressful. And sometimes we try to carry over the stress to the house. I think that's definitely not a good idea. I think once you leave your job, you have to disconnect completely. And when you come home, you have to try to spend the most valuable time with your. In my case, will be if my grandchildren are here. We try to do, just to tell you, different activities. For example, my grandson, he loves to cook. So I encourage him to do it when he is here visiting, and he always like to prepare something. So we prepare together in family, and he is very talented. And sometimes I tape what he's cooking, and we have a conversation when we eat. Um, we discourage people from watching TV.
Ah,
I think having meals with the family is one of the best things that you can have
yep.
as a family, because you have an opportunity to ask the kids how was school, how they, if they have any issues, they can communicate. So I think it's a good time to sit together, and of course, encourage them that before each meal they have to wash their hands, to pass along those good measures that we are doing it more now with the COVID-19, but it has been always a good habit to have the kids to wash the hands before meals.
Yeah. Yeah. Thank you, Dr. Ramola. And then, one other area that I know that is, heavily related to stress and that's our emotional well-being as well. And this is an area particularly research tells us that fathers struggle in this area, in mental and emotional health, in the sense of um, not getting the necessary help, that it's okay not to lean on oneself. It's okay to seek help. It's okay to talk to a friend. It's okay to talk to someone that's trained to assist. Could you talk a little bit about that and the importance of that? We as men oftentimes like think that we can hang out in the garage and we'll fix everything, and but it's really important for us to bring that message forward. Could you help us in bringing that message forward?
Well, I think it's very important to recognize that we all have defects. We are not perfect, and sometimes we have stressful situations, and we have to find a way how to navigate. And when we feel that stress is overwhelming, there is always a good opportunity to talk to people, to talk
Yeah,
about it. You can talk to a friend, if you can talk to your pastor, to your priest at church, you have to talk over to your partner, but don't keep it inside. I
right.
think it's very important. And as I mentioned, you don't bring your stress home. On the other hand, you maybe are feeling overwhelmed, you can meditate and you can, practice, for example, yoga. You can try to exercise. Actually, exercise is like a medication for people when you are depressed. It will improve. It's better than taking a pill. And if you have, either with your children or your grandchildren, you can go out and enjoy the nature. It's another good way to relax, enjoying nature, walking, and forget a little bit about the problems. Sometimes, unfortunately, we cannot cope with the stress, and things can go a little bit out of balance. But it's always good to ask for help. Don't hesitate to ask for help.
Yeah, thank you, Dr. Ramola. I think that's a really important message, and thank you for um, we say the metaphor is that we need tools, right, to put in our toolbox, and I think what you just shared is really valuable tools. And the so as we're beginning to wind down, certainly not least because I'm in in that place of life, but let's talk about being a grandfather, because that's a sort of a different place from being a father. So there are going to be grandfathers out there that are looking in as well, and they're going to recognize and relate to everything we're talking about. But there's some newness and difference in being a grandfather versus being a father. Could you share a little bit about your thoughts around that and your experiences around that?
you know s- s- to me, being a grandfather is one of the most wonderful things can happen in a father. It
Yeah.
is honestly overwhelming. And we say many times, grandkids give you oxygen. It give you a purpose of life. For me, the grandkids, you are a parent, but also you are a teacher, you are a friend. You are many things, but you are not like a father. You are a grandfather, so you can have all of that together. And today actually is the birthday of my oldest granddaughter. She lives in Stockholm, and she turned 22 today. And I
Wow.
and I cannot believe it. And my two daughters, I'm sorry, granddaughter that live in Sweden. One is 22, and the other one turned 18. And they are wonderful girls, and I'm very happy. She's studying psychology at the University of Stockholm. And my second granddaughter, who turned 18, actually, she's very committed. She's going to study medicine next year.
Oh, wow.
She's going to be the first. So, and then I have my three granddaughters that live in France. And even though we see each other often, but we have a good family time when we are together. All the grandkids, they love each other. They enjoy each other when they are together. And the ones that have here, there are three, two boys and one little girl that just turned 1.5. We spend a lot of time together, even though now my daughter lives a little bit like an hour away. But we try to spend a lot of time with them. It is really, I don't know what I could do without the grandchildren, because I feel that, again, as I say, a purpose of life, just sharing time with them, going to the different activities. I have been there for all the deliveries. I have been there for all the birthdays. I have been there for all the sports, when they play soccer, when they play. You have to participate in the life of all the activities. When they finish school, we are there, to congratulate them for the grades. So I think you have to be, as a grandfather, it is good you get involved with all the activities around. And also, you have to give a good advice to them. For example, I am a very much to and concerned about what is going on with global warming and climate change. And my grandson, who is 11, who is uh, very smart, and he actually understand about that, and he has giving that message to many other, even adults people. They say, you have to recycle, you don't throw garbage, and why people are smoke. My grandson says, to one of my friends who she smokes, he say, so and so lady, your lungs might be black,
Mm,
the lungs are pink. So I'm trying to they learn that there are some things that you shouldn't do, like smoking, and you have to. We only have one Earth, and you have to take care of of Earth.
yeah, and I love that because you're. I was once told that when I look at my grandchildren, look into the generations that I won't even be able to see. So every word that I speak, as you said, you're speaking wisdom, but you're speaking beyond your grandchildren because you know they're going to carry that message forward, and that's what generational health is all about: is carrying that message forward generationally from our children forward. So. Dr. Sandoval, I just want to thank you so very much. I'm honored to have you on the show, and I just so appreciate you and what you're doing for our community here in Fairfax and beyond. Because I know it's not just Fairfax, but I definitely wanted to thank you, and then all the hard work that you've put in terms of supporting the work that we're doing here at the Fairfax County Health Department. I want to thank you from the bottom of my heart there as well, sir. So bless you. Thank you so much, and everyone out there, please. Take heed to Dr. Ramola's guidance. And until next time, we'll see you soon. Take care. Bye bye.
Thank you so much.